Welcome to Neuro Stories, the podcast that highlights the people behind neuroscience at the Walton Centre. Together, we'll lift the lid on the complex worlds of neurology, neurosurgery, and everything in between, hearing fascinating tales of the incredible staff and services carried out in the hospital every day. Hello.
Hello, sir. Hi, my name is Oliver Tierney. I'm the Clinical Lead for Education, Risk and Governance, Walton Neuro Operating Theatres. It's a long old title, isn't it?
Yeah. So tell me a little bit about you, Oliver, and how you have got into the role that you're in today. Like, where did it all start for you?
I originally was going to do a degree in English Literature and Politics, and I was taking a gap year, and I was working on a go-kart track and singing in a band at the time. My mother, who is a theatre matron, came in one day and said, "I've got you a job in theatre." So there was
when was this? Like the 90s?
This was the late 90s.
Right.
Okay. Yeah. Ended up becoming a healthcare assistant in theatre, and kind of fell in love with the operating theatres from there. I think I'd grown up by then. It all clicked into place. Qualified in 2008. Worked at Liverpool Heart and Chest till 2013. Got turned down for two promotions, and I thought I need to take a leap of faith here.
Yeah.
I'm going around in circles. And a job came back up at Walton, so I joined Walton as a Band 5, and then fatefully it all fell into place. A clinical skills facilitator job came up as Band 6. Then the Band 7 education role came into play. I just naturally moved into those roles.
Yeah. What does ODP stand for? Because I guess a lot of people visiting hospital, if they're coming for surgery or something, they'll hear the ODP and they'll be like, I have no idea what that means.
So we're operating department practitioners, and basically in training, we're trained to work in all the specialist areas of theatre. So we have to work through recovery, scrub, and anaesthetics. So we're basically a specialist practitioner that can cover all the different areas within an operating theatre. It came about because there was a huge drop in the number of nurses coming into the operating theatres.
Right.
So it's a relatively new role. We're quite a young role, as it were.
Right.
But now you'll find ODPs not just in theatres, you'll find them in education, departmental leaders, A&Es, ITUs, etc. So the role is expanding all the time.
So what is the difference between an ODP and a nursing role then, say? Because obviously you used that as an example there.
When the ODP is qualified, they can hit the ground running within an operating theatre. From a nursing perspective, they will have to do a period of retraining almost. Because as you can imagine, when you're doing a nurse training, there's very little theatre placements. So they would have to do kind of a preceptorship in their scrub side. They'd have to do additional qualification to move into the anaesthetic side. The most easy place for a nurse to go is into recovery, because that's very much a kind of has that ward feel to it. But yes, that's the point. The ODP basically is a multi-skilled practitioner that can work in all the different areas of the operating theatre.
Why education for you? Why did you think you wanted to start imparting that wisdom?
Well, it's because way back when I decided I was going to do English Literature and Politics, my idea was to go into teaching. That was where I wanted to go, because I had this very inspirational teacher called Mr. Robinson, who was an English Literature teacher I did A-level with. So teaching was always what I wanted to do. And then when I moved into my role within theatres, you get the opportunity to work with students. And from working with students, I was lucky enough to get involved in the simulation side as well. That came into Walton. It was originally an ITU, now it's in St Watkins. So it just kind of snowballed from there. And I just love education. I love seeing a student join us in first year and then watch them qualify in third year. I love that genesis of them. Equally, Walton, we've made a name for ourselves of taking on so-called failing students. So the university will come to us and say, we've got the student who's in a bit of bother. Would you consider taking them on? And we have taken on numerous students. So I love that side of it as well, about turning people around. And a lot of the time it's simply, they've been lost in the bigger units. They just need that kind of more one-on-one kind of mentorship.
When your mum said, I've got you a job, how did that feel?
It was a shock. I won't lie to you. There was a few heated discussions, but anyone that's met my mother knows that's a pointless venture. At first, I really wasn't happy. I'd never had any interest in healthcare at that point. But then the first day in theatre, it just blew my mind. It was fascinating, absolutely fascinating.
Have you had conversations with her since to be like, oh, you were right?
Yeah, I have.
You've actually admitted it?
We have probably over a few glasses of wine, but She tells me how, you see, your mother knew best.
So she's totally took credit.
I completely took credit for me, yeah, exactly.
So tell me more about what you do in theatres from a day-to-day perspective. What is it that you are getting to grips with?
So my role now is very much a non-clinical role.
Okay.
Because I've taken on the kind of risk and governance side as well. So it's working with the students, we're working with the mentors and the students, kind of keeping on top of them. But equally, risk and governance, for anyone that's worked in risk and governance will know it's an all-consuming discipline. Not many people enjoy risk and governance. But I'm one of those weirdos that actually does really like risk and governance.
You enjoy a risk assessment?
I do love a good risk assessment, love a good PSERF investigation, etc. So that's what I do. And some days it's very run-of-the-mill. It's just ticking along. Other days it can be incredibly busy because you're dealing with lots of different incidents going on, talking with different departments, etc. So no, it's a great role. I love it.
Yeah. And theatres in particular, it's such a dynamic department. Whenever I've been in, I always remember to tuck my elbows in so I don't knock into anything, and get in scrubs if I need to go into theatre, and watch things. So what is it like being in this busy environment like theatres? What is that like?
Well, you've got to remember, theatre teams are multidisciplinary. So we've got healthcare assistants, ODPs, nurses, and anaesthetists. So there's this incredible amount of interdependence between lots of different disciplines, and a huge level of, as you would expect, precision in what we do. You've got to remember, there's probably no other area in any industry or job role where we take away all your human rights, basically. We put you to sleep and your life is totally dependent on the team around you. Halfway through a procedure, you can't put your hand up and say, can we stop, please?
Yeah.
So theatres have to have an incredible amount of interdependence. They have to be well managed, well orchestrated. And equally, the staff have to be very well drilled, because when things do go wrong, we need to deal with them rapidly.
You need to have those processes.
You do. And I think a lot of people misconceive theatres because they've watched a lot of ER or Grey's Anatomy. Huge amount of processes before that. But equally, we like it mundane. We don't want it to be chaotic. Good run theatre is quite a mundane and boring place. And that's a good thing, because you can't exist in chaos for an operating theatre. You really can't.
I remember Prof. Jenkinson saying, boring is good. Yeah. It means everything's going to plan. And I guess that's where risk and governance comes in, because you're able to take that step back and look at what's not working.
Too often in the NHS previously, we've lived very much within a blame culture where something goes wrong and it's like, Sam, you're a fool. Why did you do that? And it's a really poor way of looking at things. The vast majority of the time when we make an error, it's the system that's let us down. And it's how we learn and develop our systems better that makes safety better. So it's great that we've started to move away from that blame culture. I still think it's there, but the more we can move towards learning from incidents, the better, and that's how we make things safer. So that's risk and governance as a whole in itself.
And for you personally, what motivates you? What gets you up in the morning to come to work and do what you do?
It's working with this team. I really love working with the team around me. We're a very friendly department, and that's what motivates me to come. I've worked in departments where I dread coming in, and I never felt this at Walton. Even when we've been in really difficult times, I've always wanted to come in to this theatre.
Why is that, do you think? Why is it that it's different at the Walton Centre and not other places you've been?
I think we're blessed that we're a small trust, so everyone kind of knows each other.
Yeah.
From the kind of, someone like a HCA example will probably recognise our chief exec, where in bigger trusts, they're anonymous. And I think that makes a huge difference, because it means you have access to our director of nursing, you have access to our medical director, and they have access to you too. And equally, it helps us because we're specialised. If you think about it, in the bigger DGHs, they're working through, 8, 9, 10 different specialties.
It's a lot of pressure, yeah.
It's a huge amount of pressure. So this is where, that kind of specialist nature is actually a big boon for Walton as itself.
And what would you say are the rewarding bits of your job?
Seeing the patients through safely. Yeah. That's what I think every theatre practitioner wants to see. A nice, straightforward procedure that goes well. And equally, when we do have emergency cases come in, that we do our damn best to get these people through the operating theatres.
Because even like you said, the mundane operations that patients are coming in for, that's an exceptional moment in their lives, isn't it?
And when I say mundane, you've got to remember, some of these procedures are massive procedures.
Yeah,
you know what I mean?
Organised well,
precisely.
Quietly done.
Yeah. So seeing a patient, removal of tumour, waking up well, that's a huge thing. to see. Getting people off on time, simple things like that happen in this department are really great wins for us as well. It's all of that. I mean, equally, I just love working in the operating theatres. I've always loved the dynamism of it. So I do, and that's one side I probably miss in my role, is being in the theatres when, for example, we've got sickness at the last minute and I'm asked to jump in. I'll jump in, and I really love going back into the operating theatres and just being with the teams doing the job that I trained to do.
Yeah. From my experience being in theatre, whenever we've had like a crew in or if we're doing a documentary or anything like that, I always admire the resilience of the team. Like you said, all those different disciplines come together, and
I think that's because we have our problems like any other department, but we have a very positive culture, and I think that washes off on people. We're in a department where we empower people to speak up, where we, empower people to come forward with new ideas, etc. And you see that with the students, actually. They all say, isn't this a lovely place to work?
We're going to do the quick fire round now. Oliver, are you ready?
I'm excited.
What would you be if you weren't an ODP?
I'd be a teacher.
Okay, we covered that one. English?
English literature, probably. I did it at A-level. Absolutely loved it, and like I said earlier, one of the most inspirational people in my life was a guy called Mr. Robinson.
What's your biggest hobby?
Biggest hobby would probably be gaming. Big gamer. I've got a very understanding partner.
Favourite song?
Thunder Road, Bruce Springsteen.
Straight away.
Boom, love that song.
Favourite book?
A book called Candide by Voltaire. Very funny book on philosophy and kind of religion.
Favourite film?
Favourite film, Star Trek The Wrath of Khan. By far the best Star Trek.
Food you love?
I love Indian food. Absolutely adore it. Spicier the better.
Food you hate?
Tofu.
Really?
Pointless matter. The texture of it's
Bad
all
texture.
wrong as well. I've probably alienated all my vegetarian friends now.
What's the best advice you've ever had?
Don't be afraid to throw the hard six.
Don't be afraid to throw the hard six.
Yes, so it's a phrase from one of my favourite sci-fi television programmes, Battlestar Galactica. Take the risk, take the chance.
What's on your bucket list?
I don't really have a bucket list, to be honest. Been to America and India and stuff like that. There are a few things you always wanted to do.
Nice. And then finally, something very few people know about you.
I once got knocked out by a banana in the playground in secondary school and had to go to hospital.
Someone threw a banana at you?
Someone threw a very heavily weighted banana, struck me in the side of the head and knocked me out. And interestingly, because all my friends were horrible, I was the captain of the rugby team at that point. So every time I would then go lead the team out, people would throw bananas at me as I was running out to the pitch.
Are there any standout moments?
From a student side, there was a young student who came to us halfway through his second year, and he'd really had a terrible placement in another trust, to the point that he was quite a broken, not just a student, but as a human being as well. But we turned him round, and it was only a few weeks ago, actually, a friend of mine texted me and said, I was in London at a conference and you won't believe who I bumped into. And he's now a senior practitioner down in London. And that was really satisfying to know that he's progressed and he's flourished. 2019, we won the award for innovation at Association of Perioptic Practice Conference. Again, a great moment in my education side and a great moment for the whole team alongside Nick Carlton-Bland, who helped us set up this new kind of bespoke role within theatre, the Walton Surgical Assistant. There's so many really good memories in this place.
How has it changed over your career, would you say? Has it changed a lot, or is it the basic principles there?
So we've moved from kind of City and Guilds qualifications to diploma, now to degree. We've moved from assistants to practitioners, so we were ODAs once upon a time. Okay, so it was all kind of in-house training. So the graduate profession has developed within the ODP role. We're also seeing quite a shift in terms of gender. It was quite a male-dominated role back in the day, because it originally, we came from like the porters, etc., who were brought into theatres and trained up. And now we're seeing a huge shift of a lot more female practitioners coming into the department, which I think it's great to see. We've got this broad spectrum of people coming through. So the role has advanced huge amounts. The profession has come a long, long way.
Where do you think it's headed?
I think it's heading into a lot more specialist roles. They're developing now a lot. So we've got the anaesthetic associates, we've got the surgical care practitioners who can do, almost their own lists, etc. I think technology is going to have a huge place in theatre now. AI especially, I think, we're going to really see that in the next 5 to 10 years.
How so?
I think it'll start to revolutionise things like how we interpret scanning, how our surgical robots work. Probably changed quite the face of a lot of different disciplines in healthcare, I suspect. But yeah, I think it'll be a really useful tool if we utilise it properly.
Is there anything that you're excited for the future of ODPs, maybe here at the Walton Centre or beyond?
No, I'm just really excited for the profession. I think it's like I say, it's a young profession, but it's going in the right direction now. And it's recognised alongside nursing. Who knows where the profession's going, but it's going in the right direction.
When you think about how long you've worked in the NHS, is there anything that stays with you? Is there anything that you hold on to?
One of the things that always stuck with me was the first time I saw someone die in the operating theatres. So it was a young guy, and he'd been in a car crash, and he was the same age as me. And I remember I was holding his hand saying, "It's going to be okay, it's going to be okay." And sadly, it wasn't okay. You know, he died on the table. And that's always stuck with me. And in a strange way, it's kind of always been something that spurs me on, that even in our even the most critical of moments, the most desperate of times, you've still got to keep your head, you've still got to hold your own, you've still got to treat that person as a human being. So yeah, I think in an odd way, one of the most saddest moments of my career was actually something that's always pushed me forward in my career as well.
Thanks for listening to Neuro Stories. You can listen to more episodes on Spotify and Apple Podcasts, and you can stay up to date with the latest news and events from the hospital on our social media channels, at the Walton Centre on Facebook and Instagram, and at Walton Centre on X. If you've got any feedback, email the communications team at wcft.communications@nhs.net. This podcast was recorded, edited and hosted by Sam Fleet from the Walton Centre's communications team.